my pleasure to introduce Senator Warren to the North Country, above the notches. It's wonderful that she's able to come up and interact with you as it relates to the concerns we have, successes and challenges as it relates to the opioid epidemic. Senator Warren has worked tirelessly on a variety of policies, on tax policies that work very well, equitably and fairly for hardworking people, which is very important for all of us, for investing in child care for working families, which is important, consumer protection. It's important that as consumers, and all 320 million Americans are consumers on any given day, that we have a fair and equitable playing field when we engage with the people that are working with us as corporations, that we need to have an equal playing field and we need to have protections when we engage with them, consume products and services. It's also important that people have fair and equitable pay for a variety of good reasons, and women should get paid for equitable services as the rest of the people. So that's an important area she focuses on. And all in all, looking at a strong economy. So there's policies, there's budgets, there's tax policies that are important to focus on. So the economy works for all 320 million Americans. Each and every one of us in the community work very hard at growing a local community, and we deserve a fair playing ground so that our hard work is recognized. Specifically, when we get into the opioid epidemic, Senator Warren has worked with Elijah Cummings on an act known as the CARE Act. It is the Comprehensive Addiction Resource Emergency Act. I'm old enough to remember the Ryan White Act, and this is predicated on a very successful Ryan White program. If you remember, Ryan White was a young gentleman who died from HIV through a blood transfusion, and through that act, we have done significant work as a nation in collaboration with individuals like Senator Warren. So we have policies, procedures, and funding to make sure that people get the care that they need. And what our community is facing now is not dissimilar from HIV. The opioid epidemic sits on top of an underlying addiction, and it's important that we focus on it and that we have the opportunity to have an infrastructure that, as years come along, we will have the resources to make sure our friends, family, and neighbors get the care they need as it relates to addiction, specifically now for opioids. So this act is $100 billion over the course of 10 years. And that should enable us to do some significant work for our friend and family neighbors. So without further ado, I'm going to turn it over to Senator Warren so she can engage with all of us. And thank you.
All right, thank you very much. Thank you, Ed, for hosting us and for playing Master of Ceremonies here, and also Mike and Nancy and Tony and Jen, thank you for being here so we can have a conversation about this. And most of all, thank you all for being here. To come out on a beautiful Saturday, I know there are many things you could be doing. The skiing's good out there, the snowmobiling's good out there. It looks like a perfect day, and yet you came inside to talk about a crisis facing New Hampshire and facing our country. And I appreciate your doing that, because it's going to take all of us to make the kind of changes we need to make in this country. Let me start with this. Addiction is a medical issue, not a moral failing, and we need to treat it like that. Everything flows from that. We provide the resources necessary to deal with other medical issues. We need to provide the resources necessary to deal with this medical issue. Understand that today in America, about 200 people will die from an overdose. That's like a plane crash today. And then there'll be another one tomorrow, and the next day, 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 with no end in sight. And yet, if someone you love came to you and said, I understand, this is going to end badly, I'm ready for help. They have, across this country, less than a 1 in 10 chance of getting the medical treatment that they need. We don't treat any other medical problem that way in America. And it's time that we put the resources in to tackle the opioid problem, to tackle all of the addiction problems in the way we need to get this under control. Ed pointed out rightly that I've put together a bill with Elijah Cummings, who is very senior congressman from Baltimore, and it's all based on our lunch together one day, talking about the rising number of deaths from addiction and how the federal government nibbles around the edge. Puts in some money, and we're grateful for every nickel that gets put in, but we have to fight to get small amounts that just don't tackle the problem. And we've talked about how, in many ways, it really is like the AIDS epidemic was in the late 80s, that the federal government was always behind the curve. The numbers were growing, and the federal government stayed behind until a little boy named Ryan White announced that he had AIDS. And when that happened, our country came together and said, we're going to do what it takes. And we passed the Ryan White Care Act and put in the resources to do the research necessary, to provide the treatment necessary, and to provide the support necessary so that the number of deaths from AIDS dropped like a rock. And we now live in a country where many, many people are alive because we made the collective decision to make sure that adequate treatment was out there. I just want to see the same thing on addiction problems. So I have a bill that proposes to put $100 billion a year, over the next 10 years, directly into communities that are fighting the opioid and other addiction problems. And just so you all understand, I'll give you the very briefest of outline. It basically says the money has got to be used for addiction services, but each community is different. Communities above the notch are different from communities below the notch. The needs out west are different from the needs on the East Coast. The needs in cities may be different from the needs in rural areas. So long as the local communities can show that it goes toward effective treatment, and I'm here in New Hampshire, there's got to be accountability that the money is being used that way and that it's actually showing results. So long as you can show that virtuous circle, then the money is made available to local communities, the folks who are on the front lines. And the job of the federal government is to be a good partner in this, not to do a cookie cutter and say there's only one way to respond to this crisis, but to be a good partner. That's the basic idea behind the bill. I'll throw in two more pieces just so you know about them. The bill also has a provision to hold big pharma, the big drug companies, and the executives of big drug companies responsible when they market these drugs in ways that cause people. I should also add that as part of this and other bills I'm working on, we're pushing hard to keep these drugs from getting into the country, and in particular fentanyl, and to keep fentanyl out of our country. And part of this is about better inspection, part of it is hardening our defenses where it's coming in. But we all know the extraordinary dangers now that are posed not just by heroin, but the next step up with fentanyl and the rising number of deaths around the country because of this. So let me stop there by just having outlined this and leave it for everyone to talk about. One of the best parts about being out right now, particularly as a candidate for president, is that I get to talk about ideas I've worked on, but I also get to hear from people about how to make it better, or what parts to emphasize, or just how it is that we're going to build the grassroots support to get this done. So again, I just want to say thank you very much for giving me the opportunity to be here. Ed, I leave it back at you.
Thank you very much. So I'm going to turn to the panel. I'm going to work from Mike Lee on my left to Tony on my right. and ask them to provide us with three things to help us understand what is occurring in the North Country. One is, what's their role and relationship as it relates to addictions in general and addressing the opioid crisis in specific? I like smiles and frowns. So I'd like to hear some smiles about, tell me a little bit about some of the successes, and the frowns, well, those are some of the challenges we still face. And as Senator Warren said, we face as a community, we will solve it as a community. It's our friends and family and neighbors. I think that we can be very successful with the partnership of Washington, D.C. and appropriate investments. So I'm going to turn it over to Mike. Thank you.
All right, thank you. I'm still sort of new to New Hampshire. I've been here for 2.5 years. Shortly after I arrived, I found out I was on the Board of Trustees for North Country Health Consortium. So I was educated very quickly about some of the presenting health challenges. We also completed our community needs assessment. I'm the president of Weeks Medical Center, part of North Country Health. And one of the biggest things that we saw was behavioral health and substance use disorder. I then learned very quickly that New Hampshire was number 2 in the country for unintentional overdoses due to opioids. I was in the honeymoon period with my board. Nancy pointed out to me that there were some grants through Bureau of Drug and Alcohol Services, and then shortly thereafter through our IDN. And I said, Nancy, I don't know, do you think I should be doing this? She said, yes, someone needs to do it. I got permission within my health system. My board gave us our blessing. And we started the first MAP program in Lancaster, New Hampshire, just over 2 years ago. We've seen over 80 people in our program. We have an over 80% engagement rate, which is very good. It's a unique model. Our second grant that we did get through the IDN, we expanded to Whitefield, New Hampshire, where I live. And there were so many overdoses going on. It was amazing to me that people were really unaware of what was going on right at our local Dunkin' Donuts of all places. So that really, we took the Bureau of Drug and Alcohol Service. They have a great model. I think it's one of the best practice models around. We tweaked it to our communities. And then we got the hub and spoke grant that came down through New Hampshire. And Littleton Regional Healthcare was a recipient, so was Berlin, and those are 2 sister hospitals within North Country Health. And they said, you guys have stood up this program, what do you think? So we really stretched our behavioral health team, probably making it a priority over some of our other things, and have stood up a program in Littleton as well as Berlin. We've seen 60 people within those 2 communities, about 30 and 30, so they're neck and neck. And this was all due to encouragement from Nancy, grant funding that we got. We couldn't have done any of this if we didn't have the seed money and support. And I would like to point out that our first program where we did it, our town didn't want the program there. So I felt that I did not do a good job educating them. So I had a lot of resources come in to help educate what the program was, what it wasn't. Still had people that are opposed to the program. But I have to tell you, we have people whose lives have been changed because of the program. So I think those are the successes of our program. We still have a lot of challenges, still have a lot to learn. But getting the word out there, I think, is number 1. Number 2, I really appreciate the legislation and money coming. I think insurance companies and payers have to look at this as parity like mental health, substance use disorder, get that parity in there. I also think that the pharmacology, the big pharma, everyone likes to have a bad guy, so let's keep them as the bad guy. But I think they have to be part of the solution, because we have Suboxone, we have Naloxone, we have Vivitrol? Vivitrol. But we need to get a longer lasting medication out there, because one of the big things that people dislike about Suboxone is it has a street value. Number 1 thing being smuggled into our prisons. So our police departments and our correctional facilities, this is a bad thing, right? It's saving lives, but it's a bad thing. So I think pharma has to come out with a long-lasting solution that can be really monitored, administered while people are supported through the process.
Thank you, Mike. Jen, your thoughts?
So currently I work for the North Country Health Consortium Wellness and Recovery Model, which is a newer program designed to implement community health workers duly trained as recovery coaches into all of Coas County and northern Grafton County. So very large geographic area, which happens to be close to my heart. I'm from northern New Hampshire. I grew up here. I'm raising my children here. I love someone in long-term recovery, and addiction has affected the lives of my stepchildren. So I have a passion for what I do. The biggest piece that I feel is successful in our program and others like it is we provide a voice. We provide advocacy. We provide validation. We provide support. We ease access to treatment. We help someone to identify and discover their own recovery pathways and move along those pieces as they progress. So successfully, I feel like we provide success every single day. We provide hope every day. That's how we work, is within the confines of hope. Challenges, there are challenges every day, and they're individually based on the person who comes to me. It's never the same. The day is never the same. The challenge is never the same, and the success is never the same. So it's perspective.
Great, thank you, Jen. Nancy.
Hi, my name is Nancy Frank. I'm the CEO of the North Country Health Consortium, and we are a consortium made up of health and human service organizations in the North Country. Primary service area for most of our programs is Coas County and northern Grafton County. For many, many years, the organization has been involved primarily with the prevention side around substance use disorder. A couple of years ago, we found ourselves partnering with AHEAD, which is a property management organization, nonprofit in the North Country, because there was a need for continuation of our residential and outpatient substance use disorder treatment services in the area. And after many months of working together in partnership with the health centers in the area and the hospitals in the area and AHEAD, we came together in a partnership where we now manage the operations of the programs that come out of Friendship House, which many of you have heard of. It's an inpatient residential treatment facility. We have 2 levels of care there, high intensity and low intensity. They have different roles. We also have an intensive outpatient program and an outpatient program. We also manage the impaired driver program in the area, so we work with many people who are have maybe had a DUI or something, and they have to go through a process that's mandated by the court system, and we work with those people to try to get their licenses back so that they can be effective members of our society and get to work and do other things that we all need to do with our driver's license. I would say over the last year, we've probably touched about 1,000 individuals in all of our programs in the North Country. We have just recently found that some data from the state showed that Coas County has increased significantly admissions into treatment. So I'm really thankful for that, and I think that our services are always in need of more, but we are moving forward. One of the other advantages of partnering with our health centers and hospitals for some of these services is that we have been able to really shift into a medical model, similar to what the senator talked about, because we now can have health care provided to our clients and address addiction as a disease as it should be, so that we can move people successfully down their path into recovery. I would say that the smiles are about the people that we serve and the people that we help become successful in their road to recovery. And really the staff also that commit themselves to working with individuals who are in recovery is really significant, which then takes me to one of my challenges, which is the workforce in our area. And it is really challenging to get all kinds of workforce in the North Country, but healthcare and substance use disorder workforce is it is incredibly challenging. And to get qualified people in the area to provide these services is really hard. I would also say that funding is always an issue, and of course, we're appreciative of the federal dollars that come our way and that are potentially coming our way. But our services are primarily meeting the needs of a Medicaid population, and Medicaid reimbursement is usually much lower than the services cost us to provide. So there's very little that fills that gap. So I find those things really quite challenging in the really incredible work that happens around substance use disorder treatment.
Thank you, Nancy. Tony, we'll finish off the first round with you and let you take it away. Thanks, Tony.
Yep, thank you. Yeah, my name's Tony. I'm in recovery. I've been in recovery for about 14 and a half months. I've used a lot of the services that has been mentioned here today, and it works. I had a lot of things happen in my life where I didn't know how to control them, and I didn't understand a lot of the things that were happening in my life. And with the help of the Friendship House and the long term, I was there for 4.5 months or so. And with the help of the Friendship House and all the staff and people around me, I've like I said, 14.5 months clean now, and it works. It's not. I'm not going to say it's hard up here in the North Country, but it is difficult. If you don't have a vehicle, you're kind of stuck. The public transportation up here, we do have some, and it's great, but it's not enough. So I try to give a lot of people rides, like newcomers coming out of the Friendship House. I'll go pick them up. I try to show them for a couple of weeks where all the meetings are. Bring them to meetings, doctor's appointments. I bring them to Walmart. And I just try to help out best I can. It not only helps them, it helps me, because it's a process that you gotta work at every day. And with the help, like I said, with all these resources we have here in the North Country now, because I can tell you back 6-7 years ago when I tried, it was nothing there. It seems like the North Country's the last people to get anything. You go to Manchester and talk to somebody, they're like, oh, we've been doing that for years. You know, and I'm talking to them like it's the greatest thing in the world, you know? And so, I don't know what it is, but it seems like this half of the state gets shut out for some reason. But it's great. I'm glad I'm here today. I'm glad to have the opportunity to be up here. Thank you.
Thanks, Tony. I just wanted to have one brief follow-up question with you, talk about some of the challenges in transportation being one. Could you speak briefly about finding housing when you're in recovery and you're out of residential treatment?
Well, I'll take myself for example. I filled out some paperwork, and I weren't the best guy there. I'm also going through Grafton County Drug Court, which has been between the Friendship House and that has saved my life. I have no regrets. I'm not a bad person. I did some things that I'm not very proud of. I'll admit that today. And I'm working on myself to get that taken care of. But they wouldn't, a lot of the applications I filled out where I was, when I put down, you know, what I did and my record and stuff, that was an issue. But we got through that, but there's not much up there for people coming out of rehab or somebody that wants to move from the area there where everything's going on to get away from all that. So I guess we need to look at some of that, and yeah, I mean, there's housing up here, but it's not a lot at all.
Great, thank you. Yeah, that's an area I think we all are aware of, that housing is challenging, is affordable, and when you're coming out of recovery and trying to rebuild in a life, you like to be able to get to work, have a job, be able to go buy food, and do what all the rest of us do. So I'm going to take a moment to, I have been provided with tickets. Not look at any of them. And I'll pull one out and see who gets to ask a question. So, ticket number 9735124. I feel like I'm playing bingo. So if someone has 9735124, they can kindly step up to a microphone. Love to hear your
I have that
question.
ticket, but I don't have a question.
Okay. Well, thank you. Thank you
Could
for
have passed it along. But good.
The next ticket is 9735106. Yes, sir.
Should I step to a mic, or is it okay just to act from here?
Mike would be good, although you
I can hear you.
You could be on the radio. I mean, yeah. Give it a whirl. I can hear you.
Well, thank you to Senator Warren, and thank you to the panel. I've worked for the last several years as an advocate at one of our New Hampshire Coalition Against Domestic and Sexual Violence Crisis Center programs. And I wonder, Senator, if you may comment on how the opioid epidemic influences your thoughts on the necessary supports and treatments and resources for survivors of domestic and sexual violence and other forms of gender-based violence.
Thank you very much. You know, it's the reminder that whenever you start with one place that's got a serious problem, it connects to 6 others, and the pieces just keep cycling through. That abuse of opioids, alcohol, and abuse of human beings are often linked to each other. And the help we need in both areas is way too little. We're putting way too little of the amount of help we need. You know, and let me just link it up where we were. They both link to housing issues as well. People who can't escape a bad situation because they can't afford housing, they don't know where they go. They can't, a woman who can't pick up her 2 children and go somewhere because there's just not affordable housing available to her, or housing the other way around. Someone who's worked hard to get himself clean and now faces going back to exactly the place where he got in trouble because there's no other housing available, or no other housing that that the person knows about. So in my view, this is about getting smart and not trying just to treat one problem, but doing as much holistic work as we can. But in every case, I just have to underline this. We keep asking people to do more with less. And at the end of the day, there reaches a point where you do less with less. If the money is not there to help survivors of domestic abuse, if the money is not there to help people who have said, I've had it, I want to get clean, and the answer on the other end of the phone, or the answer when you show up at the front door is, we can take you in 3 weeks, then we're not helping, we're not doing what we need to do. So for me, I'm talking today about the problem with addiction, because it's a clear, defined epidemic that is growing in this country. But it connects to all sorts of problems that we see elsewhere. Everything from domestic abuse to children who can't do well in school, to elders whose adult children steal from them and leave them vulnerable. It works its way all the way through our system and back again. So my view on this, let's put the resources we need in here. Let's not ignore other problems, but let's put the resources in here. Let's really meet this crisis head on. Let's do what we need to do. Let's get these numbers down. And then we will have opportunities. I think we'll see a lot more things that will just work in a better direction after that. Does that make sense? Yeah, good. I hope that's helpful. Thank you. And thank you for your work. Thank you.
Great, thank you. We have time for 3 more questions, so you can call them all 3 at a time, and everybody has different abilities hearing, so I'm actually going to politely request, with the exception of the gentleman who could be on radio, to step up to a mic. And so I'm going to call the numbers, and you can step up and queue up, and we'll get as many answers as we can. Next ticket number is 9735135.
Do we have somebody? 35135? Keep going.
How about 35127?
There we go. We've got somebody.
There we go.
Keep going.
All right, how about 35128?
Should be sitting next door.
35128? Great, thank you. And the last one is 35145.
Great.
There we go.
Is that yours?
You can, I have a pass.
Oh, okay, so
All right.
one more.
One more. No peeking.
You want it?
Oh, did you give it away?
That's fine.
You can give it away.
You can give it
Take
away.
it. There you go. All right.
It's yours.
We have it.
There you go.
Thank you. All right.
There you go. We've got a
All right, first
cooperative
question.
group here.
Senator, my name is Rachel.
Hi, Rachel. Okay, Rachel, I tell you what, you speak up and we'll repeat the question if we need to. You sound pretty good too.
Oh, okay. My name is Rachel Booth. I live in Landau. My original question that I had really had to do with the problem with healthcare in the military. It really didn't have to do with this, but if you'd rather I ask a different question, I can.
Whatever you'd like to do, Rachel.
Oh, all right. I'm a Vietnam veteran, and I'm also a transgender American. And I am absolutely appalled at what they're doing with transgender service members right now in the military. And I was wondering what your stand is on that. I'm pretty sure I know what it is, but I'd like to hear what you say.
So thank you, Rachel, and thank you for the question, and thank you for your question. Three older brothers. I am the baby in my family. I was what used to be called a late in life baby. My mother always just called me the surprise. But I have three older brothers, and they all joined the military. My oldest brother, Don Reed, was career military, 288 combat missions in Vietnam. My second brother, John, was stationed overseas for over a year. My third brother, David, trained as a medic. All three of my brothers now are back in Oklahoma, where we were born and raised. They're all retired. They're all back in Oklahoma. And let me just put it this way. I have three brothers. One is a Democrat. We have a range of political views in our family. It makes for interesting Thanksgiving. But all three of my brothers and I agree on one central point. And that is anyone who is willing to step up and serve our country should be welcome. And we believe that everyone should have that opportunity for service and not be discriminated against. So thank you.
Hi, Senator. My name is Doris M., and I'm a woman in long-term recovery.
Hi, Doris.
I haven't had the need to use any substances since June of 2008.
Hello.
As a result of my recovery, today I stand before you to let you know that I'm an executive director of the North Country Serenity Center. We're a recovery community center, and I work very closely with everyone on this panel to support individuals seeking to initiate or sustain a program of recovery. And just recently, I heard that during the House Finance Committee budget talks that New Hampshire may face $750,000 cut to peer recovery support services. I don't understand that. On the other side of treatment is recovery, and it progresses over the lifetime of an individual. And I'm really concerned that if our state faces this, and we're number 2 in the state right now, in the country right now, how are you going to help people who need that peer recovery support services in this CARE Act that you're speaking of? And thank you so much for that. I can't tell you how important it is. What are you going to do for the peer recovery support piece?
Good.
The recovery support piece is so important.
Thank you, Doris. Let me just give you the arc of how I see this. The idea behind this bill is, first of all, to get the resources we need. Instead of treating addiction issues like the stepchild that has to be pushed back into the corner, that we say this is a medical problem, it needs medical treatment, and that means we have to have adequate resources. It is not enough to say you can get treatment in 3 weeks. It's treatment that's available now, but it's also all of the treatment you need. We don't say to someone, we'll set your broken leg, but we won't, sorry, if it isn't healed in 2 weeks, you're done, because that's the cutoff point. We stay with someone until the problem has worked its way through. And I know that in the case of addiction, that this is long-term for people to stay in recovery and how they get the support they need. That's why the way that Elijah and I have designed this program is to say there is a substantial amount of federal money. It would be a minimum of about $27 million to the state of New Hampshire every year, plus additional grants for special programs that different community groups could apply for. But that the community makes the decision where their need for the resources is the greatest. And that's why it's about current beds, it's about long-term support, it may be about housing options, it may include transportation options to be able to get people in a widely dispersed area in for the treatment they need, in for the jobs that they need help to be able to take. But the idea is for you to sit with Nancy and with Jen, to be able, and with Ed, to be able to talk about this is how we think we can best design the program to fit the people in North Country. And then all I ask is accountability on the other end. If you're spending this money, show how it's being spent and show the number of people that it's actually helping. If you can do that, then the money should continue to come to you until we get this problem knocked in the head.
So Senator, I just want to tell you, we opened in May of 2017 and we've seen approximately 200 individuals that are unique to seeking or to initiate or sustain a program of recovery right here in Littleton.
Yes, thank you. Good.
Hi, I'm Gail Robinson. I'm a new retiree to the state of New Hampshire, although I've skied here basically my whole life. So I really was struck by the fact that you want to change the frame from being a crime to being a medical problem. But I know in anything, when you want to change that grade, there's a lot of prevention or educational services, just informing the police, the judges, the medical profession. What's in the bill that sort of addresses that?
So that's a really good question. And again, I'm going to say that's why this is so much community focused. You know, we're seeing programs, the Open Door program, we're seeing lots of programs where police, where firefighters are getting more engaged on the front end, places where people can show up safely and say, I have a problem, I want to get clean, and they're not under any risk for being arrested immediately. Places where they can now go to detox. But there's got to be enough space for them to be able to do it. So I will describe this again as saying, I was using the people who are here, who are kind of in one end of the spectrum, but you're exactly right. When we're talking about how the community thinks is the best way to deal with the problem, police, firefighters, schools, educators need to be a part of the conversation as well. It's all the way from the front end and thinking about prevention to the back end. In fact, I'll even add one more tweak, since you're asking me about more pieces in this. It also has money in it for the National Institutes of Health. We need more research in this area.
Right.
We need more research on, you had talked about with the pharmaceutical companies, we need some of that still at the basic research level. What kind of treatment would permit people to get off drugs better and stay off them? And which ones are safest to use over the longest period of time without being something that other people want to trade in and be able to use in ways that are not safe for them. The other thing we have to put some more money into that we have not put money into as a country at the NIH is other ways to treat pain without opioids. Yes. Keep in mind that the estimate is that more than 80% of people who end up with an opioid addiction started with pills that were legally prescribed. Think about that. This is a danger among us. And for some people, it starts with something as simple as dental surgery or dislocating a shoulder and spins out of control. For others, it's a couple of pills that they get put on the shelf and somebody else in the family picks them up for whom they were not prescribed. So finding a way to treat pain, which is real. People have real pain, and some people have short-term need for treatment, in the two examples I just gave. Some people have long-term need for treatment. Arthritis, long-term conditions that cause real pain. Putting a few more dollars into the research on how to manage that without running the risk of pulling people into addiction, I think is money extraordinarily well spent. So
I agree with that.
I'm in on it.
Thank you for your questions. Thank you, Senator. I've been informed we have time for 2 more questions.
Oh, good.
So I'm going to call the 2 numbers and people can step up to the
You're
microphone.
saving time for us to take pictures afterwards,
And
aren't
will
you?
be, yes.
For anybody who wants to. Okay.
35115.
There we go.
35122.
122.
Do I have 35122? Yes,
There we go.
do.
Good.
Thank you very much.
Hello.
Hi. Tell me your name.
My name is Kobe. I'm a sophomore that goes to St. John's Berry Academy.
It's nice to see you, Kobe.
I was just wondering, when you think about teenagers and younger juuling and vaping and doing drugs and opioids and worse,
I think it's a bad idea. No, I really do. And I have supported every effort possible to get some federal regulation over juuling and other forms of the delivery of nicotine and other drugs, particularly because many of those are aimed at young people, getting them hooked early. And the impact on their brains and their lives can be devastating. This is yet another place, in my view, where the federal government has been slow to respond. And those who figured out how to make money off a gap in the regulations have zipped right in. And the price we will pay as a country, the human toll for this, is way too high. So I'm all for education programs, but I'm all for serious regulation on the manufacture, distribution, and sale to young people with products like this. So I'm talking. Yes, sir, it looks like you got the last one. Make it a good one.
I hope I will. I want to thank you and applaud you for your position about the Electoral College.
Oh, you bet.
And in keeping with that, I'd like to ask if you have any, at least preliminary thoughts about a form of democracy in this country that would be based more on national citizen petitions and referenda.
Interesting. Okay, you come to New Hampshire and you hear about democracy. I love this. So, you know, I like the question, and I think the answer is that I feel such frustration with the elected officials in Washington who just don't do the business of the people. And I get, let me start by saying, there are things we disagree on. I get that as a nation. We are a big country, has a lot of different points of view on things. There are things where we don't agree on, and there are things we're not gonna agree on, and there are things where our opinions are gonna change over time. But what frustrates me is there's a whole core of things we do agree on, and yet we can't get Washington to act. Drug companies. Drug companies, right now, Washington works great for drug companies. It's just not working for anyone trying to get a prescription filled. Amen. Right? Washington works great for giant financial companies and payday lenders, just not for people who are trying to make it paycheck to paycheck. And I think that the whole question around petition, other ways that we try to get our government to move, I'm open to the conversation, but I want to start with, let's start by just making democracy work again. The core pieces. What I'd like to see is I want to see a constitutional amendment that every American citizen gets to vote and has a right to get that vote counted. Citizens United. Democracy. Every vote should count, and that means get rid of the Electoral College, go to national I think we can do a lot better, and since you gave me a chance, I'm going to do one more pitch on this, because it actually relates to what I'm talking about today. People all around this country see the need. That's not the issue. People say, yeah, I go in rooms, I can do it in here. How many people know someone, love someone who has been lost to addiction? Yeah, right? And how many people think as a country, we need to do better? We need to get more resources out there. We need to get more beds. We need more long-term support. We need to address this problem. And yet, can't get Washington to move. Indeed, the president's budget right now is talking about cutting Medicaid. Does anyone understand? Medicaid is the principal way that people who are dealing with addiction get the medical treatment they need. You cut Medicaid and you've just said to some number of people, you're just not going to get any treatment. And to some number of places that are trying to provide that treatment, you're going to have to figure out how to do more uncompensated care, which they cannot afford to do. They simply do not have the money for it. So there is this giant disconnect between what Washington keeps doing, which helps drug companies, which keeps taxes low for billionaires, and what most of us just think are basic, sensible things to do. And I think a big part of what our 2020 is going to be about is going to be about your vision of how we run a campaign and then how we run a government. Is it really just going to be about going out and scooping up as much money as you can from a bunch of millionaires and billionaires and then running a bunch of TV ads and that's it? That's what democracy is going to look like? Or are we actually going to get out and do the hard work, the one at a time, face-to-face work of actually building a grassroots movement that holds our elected officials accountable? For me, that's why I'm in this. I'm like the least likely person you would ever find running for president. I never thought I would be in politics. I was always going to be a teacher. But I got pulled into this fight because I've watched working families just take the wrong end of the stick one time after another after another. And when I got into this fight for president, I made the decision, I'm not taking any PAC money. I'm not taking any Washington lobbyist money. I'm not spending my time on the phone with a bunch of millionaires. I'm here in rooms like this because I believe that this is how we're not
So I want to thank every one of you, my friends, family, and neighbors who come out, because this is how New Hampshire works. This is how we will find our way forward to help people with addiction so they can be in recovery and be successful members of society. I want to thank my panelists for exceptional collaborators. It's wonderful, and I want to thank Senator Warren for coming up and engaging with us in this important issue, and her staff who are often unrecognized. Put your hand up.
more terrific.
They did, and they do exceptional work on a moment's notice. They're very competent. They're really, really good. And they've been a pleasure to work with, made my life easy to come and moderate this event. So before you do go, we do have some time, and the senator will be available. My understanding is to my left, your right, to have an opportunity to meet her and perhaps get a picture. So thank you again, and have a wonderful rest of your weekend, and let's pray for spring.